Welcome people. In the last video we started off with anti-cancer drugs. We saw so many drugs are there. We saw a few names like alkylating agents, cyclophosphamide, ifosfamide, then we saw methotrexate, then we saw azathioprine, which is a purine antagonist. See, this actually cyclophosphamide is nitrogen mustard. Strange, right? Nice name. Then moving on from this, we saw the cytotoxic drugs part 2, in which we saw microtubule damaging agents like vinca alkaloids, taxanes, and vinca alkaloids examples are vincristine, vinblastine, vinorelbine. They are from the periwinkle plant. Okay, they are natural agent cancer therapy. Taxanes from the yew tree, Y-E-W, yew tree. Examples are paclitaxel and docetaxel, paclitaxel, docetaxel. Vinca alkaloids, vincristine, vinblastine, vinorelbine. Okay, you should know all these names, guys. Then coming to miscellaneous cytotoxic anti-cancer drugs, L-asparaginase. Okay. Apart from this, lot of things are there like topoisomerase 1 inhibitors, topoisomerase 2 inhibitors, antibiotics, arsenic, urea. All of these used in anti-cancer therapy. Then coming to anti-cancer drugs where there is targeted action, we have seen angiogenesis inhibitors, proteasome inhibitors, CD20 inhibitors. Just the names we have seen, don't worry, in the last video. We saw epidermal growth factor inhibitors, BCR, ABL, tyrosine kinase inhibitors. Last group, hormonal drugs. In hormonal drugs, we saw that it could be estrogen or an anti-estrogen like ethinyl estradiol or fulvestrant, or it could be a estrogen receptor modulator, could be positive or negative, tamoxifen. You could even give glucocorticoids, immunosuppressant, then you can give progesterone, you can give anti-androgens, basically try to balance the hormone levels. Okay. Moving on now, let us understand the toxicity of anti-cancer drugs. Anti-cancer drugs are very, very toxic. Very quickly, let us look at the toxicity of anti-cancer drugs. So, these anti-cancer drugs, they can cause bone marrow depression. So, what and all you will see? Neutropenia, thrombocytopenia, all types of penias you will see. Lymphoreticular tissue also is affected, so there can be lymphocytopenia. The lymphocytes may not function properly, so there can be opportunistic infections like candida infections, that is fungi infections, viral infections, toxoplasma, all these things. What is toxoplasma? Parasite, correct? So, it is a, It's a protozoa parasite. So, it can of course lead to opportunistic infection. Oral cavity can be affected, bleeding, gums, etc. GIT main issue, this they cause nausea, vomiting, these chemotherapy drugs, okay, especially cisplatin, no? This one is highly emetogenic. Cisplatin, this is highly emetogenic. All of them are emetogenic only. Cisplatin is highest. Even the cyclophosphamide, no, don't excuse that also. All of them are the same thing. Phosphamide, all of these. No excuse only. Chemotherapy, nausea, vomiting, etc. Okay. Now, then moving on to skin, alopecia, that is hair loss. You must have heard, na, like lot of these cancer people, they kind of shave their head because of hair loss. Then gonads are affected. Person can have oligospermia, impotence. Females can have amenorrhea, anovulation, etc. Fetus can get affected. They can even be killed. It could be teratogenic for the fetus. Okay. So, fetal death, abortion, teratogenic. So, lot of things can happen. Carcinogenicity, this is the irony. Irony means you're giving anti-cancer drugs to treat cancer, and that can result in other types of cancers because the drugs themselves can be carcinogenic. Then coming to hyperuricemia. Hyperuricemia is actually like increased levels of uric acid, can lead to gout, etc. So you can actually resolve it with the help of allopurinol, okay, allopurinol. This video we have covered the toxicity of anti-cancer drugs. Further in the videos, in the end of it, we will cover the solutions to this problem. That is also a huge thing. See, methods to ameliorate, reduce toxicity of anti-cancer drugs. So let us look at this later. Based on each drug, you can know what exactly to give, okay. Fine. There are a lot of ways of ameliorating toxicity due to anti-cancer drugs. We will come to all this in the next video, okay. Subsequent videos we'll look at this, okay. Bye-bye.